need to.
So we'll call the meeting to order, and I'll just look to committee for any disclosures of pecuniary interest. And I just wanted to pass it over to Councillor Usher.
Thank you, Mr. Chair. Mr. Chair, I just want to identify to the public, or maybe I remind the public, I should say, that today, August the 1st, is what is known throughout the British Commonwealth as Emancipation Day. And I'd just like to make a comment on this because I think it's very appropriate that we're receiving this staff presentation regarding community diversity and inclusive strategy on this day here in this committee. And there are many, many people who may not be aware of Emancipation Day, but Emancipation Day is always the 1st of November. And in 2008, the province of Ontario designated August the 1st as Emancipation Day, marking the end of slavery in the British Empire in the mid-19th century. The date usually falls around the August long weekend, and this time it's falling just before the August long weekend. The Ontario legislature passed the Private Members Bill, which was moved by PC MPP Ted Arnott and former Liberal MPP Maria Van Bommel. Today we commemorate the anniversary of the enactment of the British Empire Act known as Emancipation Day, inspired in large part by the heroic actions of William Wilberforce. And for those of you who may not be aware, Lucan was once known as Wilberforce, and I believe it was named after the same person. But heroic act of William Wilberforce, the British Parliament voted in 1834 to abolish slavery in most of the British Empire. The passage of the British Imperial Act made Ontario a beacon of freedom and hope and launched the Underground Railroad, as we know it, from which escaping slaves found their way to Ontario and freedom. To mark the day and the role of the Underground Railroad in Canadian history, people will be riding what is known as the Underground Freedom Train in various places, particularly, hopefully, in Toronto's subway just after midnight tonight. People will sing and play music and read poetry to commemorate the activity. So I just want to bring that to everyone's attention that today is Emancipation Day. Thank you, Mr. Chair.
Thank you very much, Councillor Usher. That was much appreciated. So I also want to note that Councillor Van Holst is here as a capacity as the acting mayor, so he'll be able to vote, and he'll be doing so manually. So I'll look to committee if there was any items on consent items that'd be like to be pulled. Seeing none, we'll put up a motion and look for a mover and seconder on the screen. Councillor Helmer.
I just want to flag on the second item there, the funding apportionment. This is something that the health unit does after every census. And I think as you look in the report, the next time we do a census, we're probably going to have an adjustment where we'll be picking up slightly more of the share than the county. And I just wanted to prepare people for that, which will be a couple years down the road.
Perfect, thank you. And that was from our in-house data guy. So it's moved and seconded. Any further speakers? And we'll call the question. Councillor Van Holst.
Closing the vote, the motion carries 5-0 with Acting Mayor Van Holst voting yay.
All right, perfect. So I'll pass it over to Mrs. Graham. But before we start, I just want to, of course, on behalf of this committee and, of course, council, thank all the members of the public who've joined us today for this, and champions, as you guys are called, and that's really true. And it's really a perfect day to be doing this. As Councillor Usher mentioned earlier, today is Emancipation Day, so I think this is very fitting. So, Ms. Graham.
So to the chair and committee, thank you very much for the opportunity for us to bring back the community diversity and inclusion strategy. We do have a presentation for you, and this is the product of several months of work by many, many Londoners. And just speaking as a staff member who has supported this process, and there are a number of staff in the room. There's very little that's more inspiring than seeing a group of Londoners come together because they have an issue that they care about and they're willing to do something about it. And this process has very much been an example of that. So it's been a real treat, and I'm thrilled that you have the chance today to hear from them. So I'd like to welcome up two individuals who are going to make the presentation. And they can come on up to the podium if you're willing. So one is Rifat Hussain, who has served as the co-chair of our steering committee throughout this process. She's also the chair of DIAC, and that's been a really important partnership for us from beginning to end of this. And the second is Joe Antone, who has also served as a really valuable member of our steering committee. And so the two of them are going to walk you through a presentation that gives an overview of the strategy that was included in your agenda, and then we'll have time for questions and discussion. So thank you very much. We'll turn it over to them.
Thank you for everyone for having us. Actually, before we begin, Joe and I would really like to not only commend but thank both Kate Graham and Kinga Colton for being actually our guiding light throughout this whole process. They gave us direction, they gave us honest feedback, and without them, this would not have been possible. So I want to thank them, and I wanted to acknowledge their work as well into this. Having said that, we want to thank the committee for the opportunity to present today. There's a purpose behind the draft community diversity and inclusion strategy with members of council. We're seeking endorsement and directions on the next step. Why this matters? As you all know, London needs to become more inclusive and embrace its diversity. Many Londoners experience oppression, and we need to do better. This work is important because it affects people's lives and the success of our city. In January, we began to develop the CDIS strategy. A group of committed Londoners came together over 3 Saturdays to develop the content in the document before you today. These were not always easy discussions, but they were productive. The champions also engaged others between meetings for input and feedback. And when we discuss not always easy discussions, the first thing that we did was we paved the way to make sure that we provided a safe space for everyone to listen, acknowledge, and learn the experiences of Londoners, not just first generation, but second, third generation. Everyone had a story, and we wanted to make sure that we provided that space to listen and learn. As one of the members of the steering committee, we provided leadership throughout the process and facilitating not only just the table discussions, but also distilling the content of the conversations into themes, turning ideas into strategies, and stewarding the process from beginning to end. And we're very, very proud of the work that we've accomplished today, and we bring it for you to present as a finished product. On some of the speaking notes, a copy of the London's Diversity and Inclusion Strategy was provided to you in your agenda packages. You will see that this document includes a number of parts: a vision, a statement of commitment, priorities, strategies, and insights from specific groups, as well as a glossary. And we're going to briefly review each part of the CDIS with you. The champions have put together what they want London to be, not just as a city right now, but also a city for the future. The vision reads, London is a diverse and inclusive community that honors, welcomes, and accepts all people, where people have the power to eliminate systemic oppressions. We will get there. There we go. We also wanted to make a shared commitment towards this vision, an affirmation that we will work together to achieve a more inclusive London in the future. And based on the input from the champions, we developed not one, but 2 statements. One for the City of London, where we are looking to the city to provide leadership in our community by being an example, and one for Londoners, where we commit to working with you. We are asking the City of London to commit to the following: mandating equity and exemplifying our vision of London as a diverse and inclusive community, learning and honoring the unique histories and lived experiences of all peoples in our community, and removing systemic barriers to accessibility as experienced by our community by listening and responding to the voices of those who are marginalized. As Londoners, we commit to working together with the City of London towards our vision of London community, modeling the community we aspire to be, respecting others, learning, acknowledging our biases, and celebrating the diversity and history of our community, and being passionate allies with our neighbors and fellow Londoners, and standing up for one another to ensure we live in a city where everyone belongs.
That was cool.
That was super cool. Moving along in the document, we have, through the engagement process with the community, which I think at one point was roughly 230 or more sort of recommendations, boiled that down into 5 priorities, I think, which was no easy task. And the 5 priorities were: take concrete steps towards healing and reconciliation, have zero tolerance for oppression, discrimination, and ignorance, connect and engage Londoners, remove accessibility barriers to services, information, and spaces, and remove employment barriers. I think also there were numerous discussions that were had from various people of different identities, and they had so much to share around what can be done. Some of that didn't necessarily make sense to boil down into a specific strategy, so we included in the document a series of write-ups about what we've heard from various populations, and they've offered numerous pieces of wisdom on how we as a city could move forward to make this place more diverse and inclusive. So you have a variety of different identities. I think you had one on anti-Black racism, you had one on Islamophobia, you had a piece from Indigenous people as well. Cannot understate the importance of having a glossary of terms in this sort of work. It's very complicated work. There's lots of words, there's lots of lingo, and so important for us to have a shared understanding of what that terminology is as we move forward to try to shift and change some of the barriers that we experience. We have DIAC to thank for getting this glossary going. I think we've made a couple adjustments to it. It is also available to the people on the city's website, from what I understand as well. Language is important, it matters, it hurts and it heals. So I think it's important that we're mindful of language and doing the work that we do. In terms of some specific directions and asks from us today, there are 4. So the first, we are seeking endorsement of the Community Diversity and Inclusion Strategy. This is an aspirational living document. It's not final, nor is it exhaustive by any means, but it's a big step in the right direction. We're asking Council to endorse this strategy so it can be put into action. Second, we need to determine a go-forward implementation structure and process. We've discussed the following model of others, following the model of other strategies, but there's also some discussion about, creating something specific to this. Our plan, and we're asking that, essentially you ask the steering committee to submit a report to you on our recommendations on how to proceed with an implementation plan. Third, we're asking, there are a number of strategies that directly involve the City of London, its employees. We're asking that you direct staff to report back to Council on how they will implement those specific strategies. And fourth, there's so many people to thank. There was lots of hard work that went into this, starting with Council approving this and saying that's important to them, all the way through to the champions, the steering committee, and the community at large. The fourth ask is that a letter of thanks be sent from the Mayor on behalf of City Council to every Londoner and London organization who participated. This letter can have the CDIS attached to it and encourage people to get involved in putting the priorities and strategies into action. I think it's fitting to end with a quote from Brian Hill, who's not only a champion of the CDIS process, but has been a champion in forwarding making London a more diverse and inclusive place for a number of years. And this was a quote that I believe he sent in a letter to council at some point, sharing some of his experience and wisdom. So I would just like to share that with you now. I may become disillusioned at times, but I will not give up, because the work I do and the changes I try and make are for the benefit of future generations. I think it's a fitting moment to talk a little bit about the 7 generations principle. I'm not sure if you've ever heard that or not. It's a principle that, as an Oneida man, is encoded in Oneida's Great Law of Peace. And it talks about the responsibility of us as people to make sure that we leave the earth 7 generations from now in a better place. It really gets to the heart of creating a sustainable community where everyone feels like they belong. And I just wanted to share that with you, that teaching that I received from the Oneida people that went before me. I think with that, I'd just like to say thank you for your hard work and for making this a priority, and would like to open up to questions if you have any.
So I just wanted to say thank you guys once again for that amazing presentation. I have to say, the City of London has asked you all to do a momentous task. We as a council always ask our advisory committees to do a lot of things. But what we essentially are asking you guys in this capacity is to help us change hearts and minds, which is a lot of work, and it's a very difficult task. So, I applaud you for that strength and for heading in this direction, because as kind of some of the words as Brian mentioned in the quote, you can become very disillusioned. You could become, want to give up. But thank you for your persistence and wanting to see this community be a little bit better. So I'll turn to committee. Councillor Usher, Armstrong.
Well, thank you, Mr. Chair. This, for me, has been a long road. So I want to thank all the members, all the people in the public and the people who are here for the input and the work that they did on this. I have been involved with this for the past 20 years in this chambers, and like the gentleman up there said, I will never give up either. And I'm so glad to be able to read a report like this that comes from the people and accept it accordingly. I'm very satisfied with the report, 99% of it. I'm still a little bit disappointed that we tend to not want to use the word racism and race relations and prejudice enough. I will accept that for now. I'm one of those people who, in 1998, when we created the race relations policy, we wanted to put right out there, right at the top of it, that there is racism in London, and the council at the time refused to accept that, and we had to remove those words and sort of tone it down a little bit. But the fact is that it's not the words that we put out there, it's the fact that it is the actions that are out there by some people. And we've got to educate those people to remove those type of language and those type of feeling and those type of culture, because on a whole, I don't believe that London is a racist community. I believe that there are people who want to practice racism in London, and that's it. And the prejudice also, by the way. So I'm very pleased that we've come this road and all this way. I just ask during the implementation that we do not be too soft on this, because I think that when this started, we were promised that we were going to be bold on this. And I think that we could still be a little bolder during the implementation aspect of it. And therefore, I'm saying to those who are going to participate, don't be afraid to be a little bit more bolder, because it's time that we become bold. And please, I ask you not to hide the words racism and race relations behind the word inclusive and inclusivity. Those are good words, they're true words, but there are other words that are out there that we got to bring to the forefront to let people know that we will not tolerate this. So I'm really proud of this. I'm really proud of the work you've done. I really appreciate it. And I thank you. And I hope that many of you will be part of the process of implementation and anything else that we do. Thank you, Mr. Chair, and thank you to all of you who are up here.
Councillor Armstrong?
I too would like to thank all of you for the work that you've done so far. The work will continue, obviously, and probably for a long time. And also recognize there are many people who, for whatever reason, couldn't be here today that also participated in the process. And so to those out there, hopefully some are able to watch now or later. Thank you for the work you've done. And also I want to recognize, I know how our staff worked on this issue and worked with you. So let's recognize them for the work they do always. And we much appreciate the hours that you put in, both regular time and after time. Thanks again to the staff. And of course, I want to recognize Councillor Usher. This is truly an issue that he has championed and taken lead on ever since I can remember, since he was on council. And I was here when he got here. And so I think kudos to him for being involved and taking a leadership role in not just on council, but in the community. Sometimes people who do that don't always get recognized, but I hope I want to recognize him now for the work he's done. So thank you, Councillor Usher.
Councillor Squire?
Thank you very much, Mr. Chair. I want to thank the community certainly for coming together to do this. I always appreciate it when our community comes together and produces a document for us. I think that's extremely helpful to hear from the community. I was born in 1958. I'm almost 60 years old. And I don't think I met someone who looked different than me until my grade 9 English teacher. Until then, everybody was the same as me. They looked the same as me. They acted the same as me. And over the years, London's become a more diverse community, and that has been clearly for the better. I can tell you I'm more comfortable in a diverse community than I am in a community that isn't diverse. However, I think we need patience with Londoners. I think we're moving along. Luckily, I have 2 teenagers who remind me every day that I have to be more tolerant. And thank you for the terms. I need that. I actually need the glossary. I think sometimes people assume that we all know what these terms mean. And I hope you're patient when I use the wrong term. It's not meant to insult anybody. It's just because I probably at times don't know better. I'm happy to endorse this. I will challenge you when you come forward to make sure that what you're doing yields results. And I'm sure you want to do the same thing. So congratulations on your work. It's extremely valuable. And I hope it isn't ignored or forgotten as we move along. So I'll be supporting this, what you brought forward today. Thank you.
Councillor, looking for any other councillors? Councillor Cassidy?
Thank you, Mr. Chair, and I don't want to repeat what everybody else has said, but it's wonderful to see everybody come out here tonight, today. It's not yet night. Maybe we'll get tonight. And I'm glad Councillor Squire spoke the way that he did, because it really does highlight the patience that our community has had, because it has taken a long time to get to where we are today. And I know I spoke personally to Brian Hill about this, and I had the pleasure to read his letter to council. So the fact that you still showed up, that the community has had to have patience all this time to see us get to this point, and that you still showed up and you came out to these meetings and you did the work that needed to be done to get this report in front of us. And I think it's a wonderful report. I concur with what Councillor Armstrong said about the work that Councillor Usher has done till now as well. He's been an advocate and a champion all along when there weren't a lot of champions, and to see the hundreds of people coming out to be champions in this endeavor is heartening. And Councillor Squire spoke about his children as well. When I speak to my children, when I hear what they know, and compare it to the way I spoke in high school, when I grew up in Sarnia, which was almost as homogenous as London was, and to hear how the newer generations coming forward just understand, and it's just comes natural to them to be accepting, to be inclusive, and to embrace the diversity in our society. I think it's a great thing. I think 7 generations down the road, we're going to be in a really great place too. So thank you, everybody.
Acting Mayor Van Holst.
Thank you, Mr. Chair, and through you, I'll had an opportunity to meet with the champions earlier today when they came and greet them, and had a chance to thank them for all their great work. I think they can have some confidence that the city is going to be a great partner. I'm just looking at our own workplace diversity and inclusion plan, our gender equity lens. So the things that we're working on, we certainly didn't send you out to do this work for no reason. Certainly, we're going to certainly follow up on this. I think the vision is a great one, and where people have the power to eliminate systemic oppression, and for us to look at the system and the subtleties in it that would cause oppression requires a great deal of awareness. So for us as a community to take this on, that's really significant, and it will make a big difference. I think the documents, a very well-navigated first leg of a journey, and now we'll have to, as a council and a corporation, crystallize this into something that we can make work, and then the people in the community will have to apply it, and as perhaps the third leg. It's going to be a challenge because humans, we're creatures that will literally and figuratively beat each other up over sports team affiliations or political affiliations. So there's those underlying issues as well. And the document alludes to it, this is really about relationship building for the whole community. And we want to make sure that it's something that builds those between everyone, because there's bridges to be made, and that may take some adroitness, but I certainly think we can do it. And you've set a great course. I, like Councillor Squire, found the glossary extremely helpful. Not only the terms themselves, but it gives you a scope of it. What terms weren't in there? When you read this, you've got a pretty good sense of this is what needs to be known. This is what people have to assimilate in order to take this on. I think one of the great terms I hadn't encountered was microaggression, because there's something to really think about, and that's really easy to see in yourself. And there's another one of those subtle things that if we can get a handle on that, we'll be moving through some of those 7 generations very quickly. So that's also great. I think our commitments are easy ones to adopt or palatable for everyone. It's a great aspiration, and I hope all Londoners can get behind it. So thank you again.
Just looking for any further speakers. Councillor Helmer.
A couple of things. So first of all, I'm glad that the steering committee came forward partway through the process and said we need a bit more time to get this right. And I know I was very impatient at the beginning, and I really wanted to get things going. And certainly taking some time has proven to be very good. I think you look at the quality of the work that is coming out from the community that has been involved, and it's extremely high. I think the like the structure, setting aside all the different aspects of this report, and specifically, I want to just talk briefly about the strategies, because I guess everyone has their own perspective on how ambitious what's being suggested is. My take on it is that it's quite ambitious. It's really going to take a huge community effort to accomplish what is being articulated in the strategies. And I think that it's really incumbent on Londoners, so, you know, not just the people who are here in this room, but people all throughout the city at all different stages of their life, with all the different identities that they have, to really step up and embrace this document, talk about what kind of what of these strategies can they, some of them are very personal, some of these things are things that individual people can do, some of them are things that organizations, very large organizations, are going to have to do. When we're talking about changing primary education, when we're talking about training educators so that they have certain training, those are going to take some institutional decisions, and they will require resources. Some of them are I think fairly easy to do, and I think we can make a lot of progress there, but some of them are not easy at all, and I think it's going to take a lot of persistence. I'm glad that the community has recognized from the outset that this is going to be a living document, and some of these things are ongoing efforts where you're never going to check the box and say we're finished with that. You know, it's something that needs to be constantly worked at. I'm really happy where we've landed in terms of the community diversity and inclusion strategy. I really hope that Londoners will go to the website, london.ca/CDIS, download this document, look at it, start thinking right now about what could you be doing in your own life to help accomplish some of these things. Because I know it's not going to go to council till the end of August, but I don't see any reason to wait. I think the sooner we get started on some of these strategies, the better. I think the 5 priorities, to talk briefly about the priorities, they're really hitting on the really important things. I'm glad that we're starting with a reconciliation and healing. I think that that's an important piece to be coming out of the Champions group. I think it's really getting at some of the major things we have to accomplish in the city, and there's things that we need to do, not that the City of London needs to do, but the community, all the residents of the City of London need to be engaged in it. And I'm looking forward to seeing how the implementation body comes forward. I think this is a very big piece of work, and I'm not sure how it's going to be managed, frankly, so I'm looking forward to that part. But I think in terms of the aspirational document and where are we trying to get to and what are the things we're going to try to do to get there, I think we've really hit the right notes. So I'm hoping the community will go check it out and start doing what they can to move things forward right now.
Thank you. Just looking to committee. So the motion is up on the screen. So if there's, was any other speakers? So Ms. Graham, did you have any final comments on this, or anyone from your team?
To the chair and the committee, just thank you again for this opportunity, and just would add my words of thanks to Joe, to Rafet, to all of the steering committee and everyone. It's been a real treat to be able to work with this group. So thank you.
Thank you very much. So the motion's up on the screen, and without further ado, we'll call the question. It's moved by Councillor Usher, and the results.
Closing the vote, the motion carries 6-0 with Acting Mayor Van Holst voting yay.
Thank you so much, everyone, for coming again today. You're more than welcome to hang out, stay with us a little longer. There's actually one of your other items on number 7, or something you might be interested in. Number 7 will be coming up after a couple more items before that, but feel free to leave. You're not obligated to stay. Thank you again, and Dayak, and take care. So we'll get the next delegation all set up. Dr. Mackey's not here today, but we have the acting medical director, who I'm sure she will introduce herself, because I misplaced that note that I had.
Thank you. Through you, Mr. Chair. So my name is Dr. Gayane Hovanesyan. I am the Associate Medical Officer of Health. Dr. Mackey unfortunately couldn't be here today, so he sent his regret. So I have 17 slides because I was asked to present a lot of data, but I understand that there is a time limitation. So I'll skip a couple of slides, but I included them for your information if you're interested in learning more about the problem that I'm going to be speaking today. So I am going to be talking about opioid crisis in London, and the presentation has 3 parts. I will talk about current situation, I'll talk about initiatives, provincial and local and federal to date, as well as highlight some of the next steps. So I'm sure that you are all aware of the opioid crisis that we are in Canada. However, I would like to highlight what I think is not covered enough, that the problem that we are in, despite opioids being around for thousands of years, is largely driven by medical and pharmaceutical industries. So this is a iatrogenic problem that we are facing. So Canada ranks second to only the US in per capita consumption of prescription opioids. And Ontario ranks the highest amongst of all provinces. What that means is, just to give you an example, in 2015 alone, 9 million prescriptions were given out to 2 million individuals in Ontario alone. That's a lot of opioids. So the harms associated with opioids have been long understated, and the benefits were overstated, and doctors were told by pharmaceutical company in particular that the addiction rates are almost negligible, and the benefits outweigh any consideration for the harms. So not surprisingly, given that 15 to 30% of Canadians experience some form of chronic pain, there is a lot of push to prescribe opioids, despite not a strong evidence for use of these drugs for outside of chronic cancer pain. So the deaths correspondingly skyrocketed. Some provinces are experiencing, particularly BC, in a very, very high rates of opioid death rates currently, and rates are increasing in other provinces as well. So some communities are hit harder than others, especially in particular First Nation communities. So what we know about addictions, there are some factors that predispose people becoming addicted to opioids, and in particular when people are prescribed high-dose opioids, or they are prescribed longer duration, or they have depression or other mental health issues, then and also young people are more likely to become addicted to opioids. So this is about Middlesex, London. So we know that there are 3,200 people, individuals that currently are on opioid maintenance therapy. So these are drugs that are used for those that have addiction to opioids. So there are 60,000 people that were dispensed opioid in 2016 alone. So in 2014, the data there is 2014 is 101, 2016 is double that number there. And opioid-related deaths, they fluctuate, but there were 25 deaths in 2015. So, and what's most important is every single one of these deaths are preventable. So I will skip the slide. So this is about opioid-related death rate, and this is the age groups that are affected most. And if you're interested to know which drugs are found at the time of death, the slide speaks to that. So what's unique about London is also that we also have high injection drug use problem in London. And we also have a multi-drug use problem in London. We have high rate of crystal meth use in addition to opioids. So last year we declared a public health emergency due to rise of infectious diseases and concurrent outbreaks of HIV, invasive group A streptococcal disease, which is a disease that can cause sepsis, and flesh-eating disease. and infective endocarditis, as well as hepatitis C. So, and injection drug use population is the most affected population. So what's been done so far? There are provincial initiatives to address opioid crisis, and there are strategies that were released by provincial government in November 2016, Ontario's opioid strategy, and you can see there is a lot of focus on physician prescribing practices, access to opioid substitution therapy, access to naloxone, which is the drug that reverses effects of the opioids, and also developing better data monitoring and surveillance systems. And the provincial government also has a focus on increasing access to supervised injection services, as well as access of treatment and harm reduction in First Nation communities. So there are also multiple initiatives from provincial professional associations and regulatory bodies. So there are guidelines that were issued for pain management, for opioids, for chronic non-cancer pain, and there are also initiatives by the College of Physicians and Surgeons, and warning letters are issued to prescribers of high-dose opioids, because those are the ones that have potential for high diversion. And also, we are expecting that in this fall, there is going to be a new initiative from Health Quality Ontario. They will issue opioid practice cards to physicians. And while all these initiatives are great, so there is a risk of rapid change of practices, which can have devastating effect, because we know that some of the opioid overdose death crisis that's happening in the US and in BC is partially attributed to rapid change of the guidelines and replacement of prescription opioids to illicit, tainted alternatives. So there are multiple strategies. I will just highlight some of them that are happening locally. Of course, you're aware about Community Drug and Alcohol Strategy, which is a community collaborative and has representation from 30 individuals and agencies. This is a long-term initiative, so we are in year 2 of the initiative. So other cities and communities that worked on drug strategies, usually it takes 3 to 4 years before they are able to put together a strategy. So there is opioid overdose surveillance working group. So this one, we have representation from first responders, EMS, and their base hospital. We have citywide emergency department chief and other emergency doctors, police, regional coroner, and hospitals participating in this initiative. And the focus is development of early warning system to detect opioid overdose increase in the community. So this is sounds like easy task, but there is no single agency that has all the data to be able to kind of paint the picture on what's happening. So that's why we are all coming together to put all our data sources to be able to say what's happening in the community and to be able to respond. So there are a naloxone community steering committee that has representation from 3 agencies listed there. So there is physician leadership group on opioids, and we are working with lead physicians to develop a workshop and continuous professional development opportunity for doctors, and collaborating with regulatory and professional colleges. And also there is a supervised injection services local leadership group, which I initiated when I was the acting medical officer of health. And now the group would like to expand, the mayor would like to expand the mandate of the group to focus not only on SIS public consultation, but also on opioid crisis response plan. So in terms of next steps, I think the opioid is the situation that we are in is a complex problem and requires complex and multi-pronged solution. And I think there are opportunities for a short-term work that needs to be done with kind of more action-focused And this is where I think opioid working group fits. And there is also long-term strategy that's going to be developed by community drug and alcohol strategies, which will work on prevention, 4 pillars, prevention, harm reduction, enforcement, treatment, as well as underlying issues leading to opioid use, such as social determinants of health, and as well as physician prescribing practices. So in terms of final words, just we are part of the national opioid crisis. We do have other complicating factors here in London, in addition to the ones that other communities are experiencing, and in particular to more injection drug use. And also we have outbreaks that other communities do not experience in this population, and urgent responses needed to prevent overdose crisis. Thank you very much. If you have any questions, I would be happy to take them.
Thank you very much. Councillor Armstrong, and then look for further speakers.
Well, first of all, thank you for coming here today and pitch hitting for the medical officer of health. I guess I think the thing is with, and I think the number you quoted was 25 deaths related, and I believe, was that since 2016? Or?
Is it not working? So in 2015, we had 25 deaths. So the reason that we don't have data from more recent data is because in Ontario, there is a time lag when coroners release their data. So of course, as a part of this opioid surveillance working group, we have chief coroner there. So informally we have data, but unfortunately, I don't have permission to release that. Sorry, was that the question?
So how it works with your microphone, you just have to, once you have it, then he can't talk and vice versa.
Well, I think 25 deaths is a crisis already, and hopefully that number will go down through initiatives like this. I guess the thing is, you said something at the beginning that pharmaceutical companies didn't inform doctors how addictive these opiates could be. And if that's true, that statement, if I'm quoting you correctly, I think the pharmaceutical companies have some responsibility for the crisis. And I hope someone, whether it's a federal, provincial government, will go back in time and review whether or not they had some responsibility. Because people have died, a lot more will die. We know there's a crisis. We know what the cause is. And if in fact the pharmaceutical industry knew, or maybe they didn't know, I don't know, that's the question, how harmful, how addictive these drugs are, that they should take some responsibility for what's happened, what's going to continue to happen. And then we got to look at the other issue of the cost to healthcare, all those things. Somewhat reminds me a little bit about cigarettes many, many years ago, you know? And I'm sure you've seen old documentaries where, you know, the board members of some of these big cigarette companies, they got up and stated that cigarettes are not harmful. Well, opiates can be harmful when they're dispensed inappropriately or unnecessarily. And that's the question today. So I leave that with you. I don't know if you want to comment further on that. Do you think the pharmaceutical industry should take some responsibility for not informing doctors? And the other and second part to the question, there must have been red flags at some point in time in the past, because this just didn't happen last year. There was a trigger point when prescriptions, the usage, overprescribed, started going up. When was that? Did somehow government, whichever government, all governments, the health professionals, did we miss this? Could this have been sort of tackled and looked at earlier? Is this the crisis now, or really was the crisis 3, 4, 5 years ago? We were into the crisis, and now only we're moving on this issue when the death numbers are just unbelievable, all preventative. So I hope that you can see there's 2 questions in there, so if I could have some comments from you.
Through you, Mr. Chair. So thank you very much for your questions. You're raising valid points. Of course, I do feel that we don't speak enough about pharmaceutical industry and what they could have done, and they are not very forthcoming to come to the plate, but they have been lawsuits, and they lost in those lawsuits, and in the US in particular, I'm aware of lawsuits. So with regards to whether we had crisis and we missed the crisis, so I guess the part of the problem is that there is so much stigma about this, and there is so much unwillingness to speak, and people are afraid that they will be labeled. I think we hear more and more about stories and who these people are, and they are not like they are coming from all across all walks of life. So we had a straight A student in Ottawa that died just in January. We had a nurse who just passed due to overdose recently. It's affecting people in a way that probably there is more publicity now and people are more forthcoming, and that the quality of data is going to be better, so we'll do a better job in documenting and also advocating on behalf of people that are afraid to speak and to ask for help.
I think your microphone's on.
Well, that's the trick. I hope people, the media will, when they cover this story, I hope they'll let people know that the entire community understands addiction, and times have changed, and people have to feel that they can go to their family, their friends, their colleagues, their doctors, whoever, that we are not going to be judgmental, but we are there to help. And because addiction is a very difficult thing to deal with. So I guess the other thing, and I'm glad that this is happening, I really am. You mentioned the spin-off, that quite often when the opiates are no longer available for whatever reason, quite often people are beginning to turn to other drugs. And these drugs quite often are, and I've spoken at council about this, meth and crack. We have an epidemic in that area as well, but it's not being addressed here, I don't think. And I would really like, I'm hoping, and I'm sure this committee and council will support this initiative, but when you go back to the health unit, I hope that you will also look at whether or not we need a strategy somewhat similar to this to deal with methadone and crack, because it is very addicting. They're lethal. They literally destroy people, and not prescribed by a doctor, but rather by your neighborhood drug dealer. And so I hope that you will look at a strategy for that and come back someday soon, because I think there's a crisis there. So let us not delay dealing with that issue one day. This has been delayed for a little while. I think if we go back and look at the numbers and statistics, especially from the States, this problem was on its way here. And the crack and methadone issue is here now too. And I can only tell you, just the other morning at 7 o'clock in the morning, I'm on Clark Road in my ward, and there's a person in distress, total distress. Now, I can't tell you whether it was opiates or crack or meth, but based on my observations, is one of the three. That person ended up in a police car and taken away, hopefully for treatment, not for incarceration. But it's out there. It's literally people are going down in the streets. So this is a very serious situation, and that drove it home for me even more than I already knew how bad it is out there. So thank you so much for your interest in coming here.
Councillor Squire.
Thank you very much, and thank you very much for your presentation. I have to admit, through you, Mr. Chair, I'm a little bit challenged today in terms of saying let's just form a working group to deal with opiates. You know, in the last while, I have clients, mental health clients, who all the time they're suffering from polysubstance abuse, not necessarily opiates. And I'm being begged by psychiatric doctors at Parkwood, London Health Sciences Center, that the city needs to do something about that. Dr. Michael Milo said the biggest crisis right now in the City of London, as far as he's concerned, is use of crack cocaine. I think we need a more all-encompassing approach to this. And you know, when I saw 6 or 7 different groups right now dealing with this issue, some are dealing with it on a very urgent basis, some aren't. I'm challenged to understand, have we reached out to those groups? Have we talked to them? Have we said, can we form one group out of 6 or 7 groups? And so I'm just challenged right now to say, here we go, let's form a working group to deal with opiate use. And that's what we need. It's challenging me right now, and I would need, I think I would need more information because I want it to work. I want it to be effective. But I also want it to help the people that I see every day. And I'm not sure that this does in its present form. So I also, just as recently as a week ago, a federal drug prosecutor came to me and said, I need to get involved. Nobody's ever approached me. Nobody's ever talked to me. I'm the guy who knows what drugs are coming into London, the most recent drugs. And I put him in touch with another group that I know Councillor Van Holst is sitting on and Ms. McDonald sitting down. I don't know what they do. I would prefer today for referral back to get that information, to find out, is this the correct approach? Does it need to be a more all-encompassing approach? Is this the only area where we have a crisis? Because I'm told it's not. That it's not just opiate use, that it's other street drugs that are certainly causing difficulties for my clients who are repeatedly in psychiatric facilities, unable to obtain housing because of street-level drugs that aren't opiates. So I'll listen to the rest of the committee, but I'd rather have all that information. I'd rather know what all these committees do and how they can work together. I don't think there's any harm in that. I don't think there's any harm in going away and saying, look, how can we get these other groups involved? Because I will admit, I worry it'll become political. This will become a political exercise rather than a treatment exercise. So I don't know if anyone from staff can help me with this and whether I'm crazy or whether I'm sort of, my thoughts are in the right direction, because I accept there's an opiate crisis, but I believe there's crises in other areas in the city. So that's a question for staff.
I think Ms. Data Beers is.
Can I try to answer? Because I put together some of these working groups myself, so I know what they do.
Sorry, if I could just
Sorry.
Just for decorum purpose, I'm right over here, the counselor. Sorry, no problem. So I just want to know, he did want it to go to staff, and then I'll see if the counselor has an interest, and I'll come back to you. So I'll go to civic administration.
Through the chair, thank you very much for the question. We are actively involved in a number of the working groups that have been presented this evening. Obviously, the community drug and alcohol strategy, and you spoke to that already, has been working on some work. You'll know that council's approved, as part of your strategic plan, a mental health and addiction strategy, which is a broader umbrella piece of work that we're doing as well. We see the community drug and alcohol strategy and the work that is being presented to you today as a recommendation, part of that, but we also see the work that we're doing as relates to what you've directed us to do, is developing a broader umbrella strategy. So I think we are involved in this work. We have been involved with this work with many other stakeholders in our community in my service area and Ms. Smith from Ms. Livingston, who's away today, but we are involved in that work. We continue to be involved in that work. And we can provide more information further to the report that we gave to council back in January about all the other pieces of information and the pieces of work that's being happened in the community, and certainly would take direction from council about how you'd like to be us to be involved in this work moving forward.
I think given that information, that's going to be the road that I'll be looking to go down, is before we say, look, we're going to form another working group to deal with a particular area, that we at least get a comprehensive report back to tell us all of the problems. Because I'll be frank with you, I don't want to go out to my next hearing at Parkwood Hospital and have one of the treating psychiatrists say, Squire, I've been talking to you about this problem for 2 years, and now you're forming a working group to deal with one aspect of it. And, you know, how are you helping your clients? How are you helping these people with the polysubstance abuse problems when you do that? And how do I go back to this federal drug prosecutor and say, thanks for being involved on this committee, but there's another committee that's being formed. I don't see the harm in getting that information, but perhaps the committee disagrees with it.
Thank you, Councilor Squire. I did have a clarifying question to Ms. Day de Beers. You said you guys were recommending something? Sorry, or there was a recommendation from your end, or I misheard that?
Through the chair, my comment was if a committee and then council decides that they want us to be involved in this kind of work, we're happy to do that as well. With any recommendations that you want to bring forward to us to do.
Okay, perfect. Just wanted to clarify that. Sorry, you wanted to add something to that?
Oh, sorry. I think your points are well taken. We do have multi-drug use in the community. So why opioids, to separate opioids? The urgency is that even though we are not there yet, but we may as well find ourselves in a situation that BC is when people are dropping dead, and we know that those are preventable. So I think the responsibility to be prepared, to do something to prevent that from happening, it is more urgent. The multi-drug use and all the other issues that you mentioned, including housing, I think that's in the mandate of the community drug and alcohol strategy, but that's a slower and long-term process. So instead of waiting for that all-encompassing, because they will be looking into alcohol, they will be looking into crystal meth and other drugs, but that will be couple of years from now. So if a crisis hits London, same way as Vancouver, so and we know that that's real. So and there are warning signs that given that London has high prescribing practices and high reliance on prescription opioids, so that may as well be a problem here. So, in general, I don't want to go into the medical part of it, but, and I'm not full disclosure, I'm not an addiction specialist or mental health or a psychiatrist. So, but my conversations and discussions with the experts are such that stimulants, such as crack, cocaine, as well as crystal meth, unfortunately, there is not much to do there with regards to, like, the treatment options are quite limited. But those people that suffer from multi-drug substance use disorders, they tend to get better when opioids are controlled. So if opioid part is taken care, so because opioids seem to be drug of choice for many of those patients, and the stimulants, in particular crystal meth, they are drugs of convenience. So according to the experts that I spoke to, it's possible that we'll get the benefit if we do address opioid part of it.
Thank you. Councilor Van Holster.
Thank you. It takes a while to get used to this. So I do sit on the Community Drug and Alcohol Strategy Steering Committee, and it does bear with it a little frustration because it is a longer-term strategy we're looking at, and those of us who want something to happen quickly don't see that effect. So I do see some value in taking this one on. The opioids are a very complicated problem. And I think they need to be addressed, especially since the addictions come from very innocent ways. These aren't people addicted to opioids. Often aren't people who were looking to use drugs. They just had a back problem or some other chronic pain, and were prescribed something that they developed a dependence on, and it can be very, very difficult to get off and very, very alarming for them. I know some people personally that have struggled with that, and you know, witnessed. I was there attempting to avert a suicide as a result of this kind of thing, which was successful. I should say the attempt to avert it was. So I see some value here, definitely in being able to move on this in a more immediate fashion. I have a question through the chair, just speaking with the mayor about this. He was saying that this group may also be liaising with other levels of the government and working in that fashion. Is that the case, or can you describe how that might be the case if it is?
I apologize through you, Mr. Chair. I don't know what level of government the group would like to liaise. As I said, I'm today presenting on behalf of Dr. Mackey, and I wasn't involved in the recent work that the group has done. So one aspect of the group, the original one, was related to supervised injection services part. So whether that's what you refer to, is it, because that group needs to, as a part of the supervised injection side, there is a need for seeking exemption from federal government. But that's, sorry, I'm not very helpful there.
That's fine. Thank you very much. Just looking at the mandate here, what we're hoping to do, consultation with the community, and exploration of a response to the current situation, development of recommendations. I think we must have a sense already of what some of those recommendations might be. Could you perhaps share some of those? What kind of direction are we likely to go in?
I apologize. I wouldn't be able to talk about the recommendations. So with regards to supervised injection site, I can speak more specifically, but I'm afraid I would not be able to speak about particular recommendations from the group.
All right. Thank you.
Sorry, I believe I had Councillor Armstrong and then, Councillor Usher, and then, and the referral's up on the screen. It's been moved and seconded.
Well, one of the things I'd like to know, and I don't know if there's anybody here who could respond to it, but I'm looking at the second bullet of the presentation which says opioid overdose surveillance working group. And the representation on that group, does anybody here knows who, under whose jurisdiction this group works, and whether this opioid crisis working group is not the same as that? Because it seems to me that if we're going to form this, it would be those same people, and I'm just trying to figure out the difference. I don't want to start something that we have already been doing. If we're going to build on it or replace it or expand it to this, that's a different story. So is there anybody from staff who can respond to this?
Through the chair, I don't have that information. We can certainly get that information and get back to you as quickly as possible.
The reason I ask, if you look at this, it says representative of EMS, base hospital, LHSC, citywide ED chief, police, regional coroner. And it seems to me that the request here, Mr. Chair and members of the committee, is pretty much of the same group. The only difference is the name. This says overdose surveillance. This one call it crisis. But it seemed to me it's one and the same thing. She has seemed to have.
Through you, Mr. Chair. So I apologize. I forgot to put Middlesex London Health Unit there. I organized this group. I brought the stakeholders together. And, you know, you probably heard the announcement from the Ministry of Health. So we are given the mandate to do this work. So recently, the Minister Hoskins made an announcement and asked public health units to work on 3 areas. One of them is development of opioid surveillance. The other one is opioid crisis response, and the third one, expanding naloxone programs. So that's why we are involved in all of those working groups. The reason that we have so many working groups, and I take your point that there are too many working groups. The problem is so big, it's really impossible to have discussion about this when you have 30 people in the room and they are coming and bringing different mandate and want to work on different parts. So this group is particularly focused on the data. We are trying to understand which organization has data related to opioid overdose. And we are asking police, what type of data do you have? How do you collect your data? Can we share the data? What pieces you have that other organizations don't have? And we are asking all these questions to EMS, to emergency departments, because trust me, this is so complicated, even having 12 people in the room with all these agencies. What's great is this initiated great discussions among all the parties involved, which typically don't talk together about this type of issues. And we have not only London Police, but we have also OPP, and they really wanted to be part of this group because they were struggling with understanding what's the opioid situation. So this is particularly the surveillance, the data piece of the group.
So you wouldn't see a conflict or some kind of difference between this group and a crisis working group? Because it just seemed to me that it's the same thing. It just seemed to me that it's a different level, but it's the same people that would be part of it and different reporting structure. Seems to me, and I may be wrong, I'm just going by what you just said. Sounds to me that the surveillance group will report to the Middlesex London Health, and the crisis working group, who are pretty much the same people, will report to city. I'm a little taken back and I'm a little confused about this. I don't want to form two groups that is doing the same thing. But if it's two groups are doing something totally different and they're going to accomplish their purpose and so on, I don't mind, so long as the purpose is clear. So.
Through you, Mr. Chair. So the groups, even though they may have a similar representation, they are not going to be repeating same work. The idea is to have a single body that would be aware of all these working groups, because even today, if the council doesn't approve the creation of opioid group, we are not going to be stopping this work. So we are continuing working with the stakeholders involved, and that work will continue. The idea was to have a kind of more central body that would know what all the pieces are, almost pieces of the puzzles, and who does what. But the concept of putting something together that all the parties are aware that this is the work that's happening, and some of the other pieces other than surveillance part or naloxone distribution part can be, some communities did citywide emergency exercises, for example. So that could be part of the response strategy. Another part, some health units such as Toronto, as a part of their opioid response plan, they put pharmaceutical industries there and asking for the advocacy pieces and bringing holding those parties accountable. So it seems to be very confusing because there are so many pieces of there are groups and there are so many pieces of puzzle together. So this group will, if the council approves, I think it will just provide the overall kind of almost a hub for all of these other working groups to share information and to make sure that everybody that needs to know is aware of what's happening.
So, Mr. Chair, I'm reading the proposal here and I'm reading the motion here, which is two different things, if I'm right. And what I would like to see is, I agree with what we have here and I agree with what you're saying, but I am not prepared to agree with this motion today. What I'd like to see a bigger picture that have these groups and the part that such a crisis group would play alongside with the surveillance group and any other group. I think we need a whole picture. I don't think that we should go from this committee blindly and say, yeah, let's approve this. We need more information. So I cannot support the request as it is, but if I'm reading this motion that you have here rightly, it says be referred to the Civic Administration for review and report back on the broader issue regarding addiction in order to ensure that the next step be taken by the city are the most effective terms. All I want in here added is, show us the whole picture though. Don't just tell me about this one or this one. I need that surveillance group, I need this crisis group, and if there's anything else there, show me the whole picture of the part that we're playing in the community. That's what I'd like to see.
Thank you, and I'll just look to administration, to the clerks. So is it possible to just add the one piece where, or do you need that in here, where it talks about the, just kind of reporting back on kind of, I guess, the differences between the groups, or will you be able to, with the groups that mentioned by Councillor Usher, will that be able to be achieved with this current motion, or do you need that added in there as well? Okay, so I think we have some suggested wording from the clerks, and look to Councillor Squire if he's okay with that front. And so, yeah, so there's some suggested wording, so the clerks will work on that in the meanwhile. But I believe in the speakers list, we have Councillor Cassidy, so go to her. And sorry, my mistake. You're okay? Did you have a point of order, or did you want? Councillor Cassidy, go ahead.
Thank you, Mr. Chair. I just want to address, first of all, Councillor Usher's concerns. I think the requested direction is that to go, it's not to just automatically establish this working group. It says the mayor be directed to liaise with key community stakeholders, and that the working group report back with a proposed terms of reference. So I think that provides us with some of that latitude to get more information before we go too far down the road. And as far as this particular and why this particular situation deserves our immediate attention, it is a medical emergency. It has been identified by the province as a medical emergency in London, and we see all of the spillover effects with the HIV rates and the Hep C rates and all of those other infectious diseases. All of this is interrelated, and we're in a crisis situation that deserves immediate attention. We know that, the doctor gave us the stats about, opioid use in Canada being #2 per capita in the world, Ontario being #1 in Canada, and London being extremely high, higher than the provincial average in so many of these areas that are affected by the opioid crisis. Our prescription rates are higher, the addiction rates are higher, the overdose rates are higher. It is, and this is what we fund the Middlesex London Health Unit to do. We fund them to identify these health crises and come to us to address it from a governance point of view. They have their mandate to address the health crisis from the health perspective, but it takes, for a very serious crisis like this, it takes the governance body to take a lead on this. So I don't want to refer this back. As Councillor Armstrong said, this has been building for some time, and I have the privilege to sit on the health board now since the fall. So I have been hearing about this crisis and about the related medical issues that go hand in glove with this. So this has been building, and I think it's something that we have to attend to immediately. I don't think it's something that we can delay any longer. And I would urge this committee to not support referral back, but to instead support the motion that is in the mayor's letter. And if Councillor Usher wanted to add a C or adjust some of the wording in that motion to provide some comfort, then I would suggest he do something like that, but I don't want to see us refer this back.
Councillor Van Holst, Squire.
Thank you, Mr. Chair. So I think that the doctor is suggesting an anti-siloing initiative. We've got a number of groups that we will need to pull together in order to take action. And if that's the case, I think it is definitely something worth moving forward with, because that's often the difficulty in the community drug and alcohol strategy. It's often that groups don't know what each other is doing. I've seen this in a mental health strategy too, where we're just, there was a group trying to figure out what research needed to be done, and the first thing they identified was that we don't know what the other groups are doing. So this could be valuable. I would agree that the letter seems to be a little short on the kind of information we would want in order to pass something. So I'm wondering if for council, when this comes forward, staff could bring a list of those organizations, or maybe I could ask through the chair, the doctor, again, just tell us exactly who we want and who we need to have together on this particular initiatives, not necessarily the other one. Councillor Ush is saying they look the same, but if you could tell us who we need to pull together and why, that might be helpful in making a decision here. Because just to go out and consult with the community seems a little too vague, and it may not seem direct enough as an action. So maybe that was a question that was a little too long and diluted. So then to our guest, which groups do we need to pull together in order to make a difference on this issue?
Through you, Mr. Chair. And again, so I'm not part of this group, so I can present what I think should happen, but it's ultimately to the mayor and members of the group. So I started the group, but the group had different mandate when I was in acting position. It was more focused towards SIS and mandatory piece that there is for SIS, supervised injection services, which is consultation. So this group, now the mayor is asking to expand the mandate of this group and work, because SIS is part of the solution, is not the solution. And they would like to expand the mandate. So I'm happy to share what I think need to be the membership of the group, but I'm not a member of this particular group. So so the group can be large or it can be small, depending on how fast things need to be moved. So they may choose to keep it small, so more action-oriented, more task force, and they can bring representatives from different groups, such as Community Drug and Alcohol Strategy, to ask them to present what's happening and to present the current status with regards to CDAS. Or they can bring some of the other group representation and ask them what's happening. So that can be done, handled in that manner, as opposed to expanding the group membership to include 30 different organizations. Because currently the group has representation from London Police, it has Middlesex London representation, it has a regional HIV and AIDS connection, LIHC. Those are key agencies that are involved there. I think that depending on the scope of the work that they would like to do, if they would like to tackle emergency preparedness piece, then that would require either representation or direction to city, to include an exercise, citywide exercise for opioid response. Or they may decide to broaden the group participation and bring, the emergency doc department, fire, and other like EMS, all those stakeholders at the table. So, but there are different ways of handling this.
Thank you very much for that. So, what I understand, and this is, and I believe I'd heard this group was acting previously, is this is already established a group. The mayor's looking to expand it, and the reason he's coming to us is that he wants civic administration to help develop the terms of reference, including the timeline. So we've got something that's already moving ahead. The mayor's asking to expand that, and he's looking for us to okay some resources for that. And in that light, I think I'm willing to support this, because I think it is definitely a crisis, and a big one that we need to move on. So those are my comments, and thank you for your answers. And I apologize, you didn't have all the information. You're a bit on the spot here, and we're asking a lot from you, but I appreciate your patience in helping us piece this together.
Councillor Helmer, and if you like, you can have a seat there. You can have a seat if you like, and answer from there if you like as well. Councillor Helmer?
Thank you, and thanks, Dr. Ovanesian, for giving the presentation. I think it's helpful to be discussing this issue here at committee. As my colleagues know, I'm the chair of the Board of Health, and this is not something we talk about once a year. This is something that's coming up almost every meeting. We have updates about what's happening with the epidemic of HIV and hepatitis C that we're seeing in the city, what we're doing internally to reallocate resources, what other agencies are doing in response to the problems that are caused by people injecting drugs at various different kinds. I can tell you that I support this kind of approach from the mayor, which is to come to council and see if we support this idea, rather than just going off and doing things on his own. And so I want to start by saying that I think that that's a good approach from the mayor. I know that this is something that the Supervised Injection Services Leadership Group was something initiated by the health unit when Dr. Ovanesian was the acting medical officer of health. And I think that one of the deficiencies of that is that that is just a group created by the health unit, and we at council, we don't know much about it, right? And unless it comes up at council somehow, how are we supposed to know that that's even happening, right? And I think that, especially when it comes to consultation with the community, and specifically the issue around, supervised injection services, people are kind of in the dark about what's happening. They don't understand exactly where that's at. There was a report that came out in February, and since then there's been not very much in terms of like what is happening and what's going on. There actually is a lot going on, but I think people are unclear about who's in charge and who's doing what. And I think this is an attempt to try and bring some clarity to that. And I know that that group was started to really focus on supervised injection services. I think recognizing that, the opioid crisis is broader than that. And as many people have pointed out already today, it's not even just an opioid crisis. Crystal methamphetamine is certainly the most popular drug that's being injected. After that, you've got hydromorphone, morphine, and then Ritalin, which doesn't come up that often as an injectable drug that we need to be worried about. That's the fourth most popular drug injected in London by people who are injecting drugs in public. So, that's probably news to a lot of people. It came out of that feasibility study about supervised injection services. What kind of drugs are you actually injecting? This is a very serious problem, and I think it's to be expected that it's going to be confusing and not totally well organized, because it's a problem that's changing all the time, and it's a very difficult problem. It involves all kinds of different agencies at different levels of government. It involves the nonprofit organizations and individuals who are very hard to reach and get into treatment. So, for example, the health unit has reallocated resources to create street outreach teams in partnership with some other community organizations. That is proving to be quite effective, partly because one of the big issues when you're trying to get people who have uncontrolled HIV, you have to keep them in treatment to keep their viral load down. If their viral load down is low, then they're not going to spread HIV the same way they would if they were not in treatment. But there are a lot of barriers that people who are, especially if they're homeless or they have mental health issue and they have addictions and they're HIV positive, there are a lot of barriers that they face in trying to access care and staying in treatment. And the outreach teams really help with that specific aspect. They can find people, they can get them back into treatment, they can take them to their appointments, and so on. So I think that having some leadership from the city can do this one specific part, which is to say, okay, who needs to be on this working group to kind of coordinate what's happening around the opioid crisis? Can we just figure out what the terms of reference of that will be and come back and say, this is what we're going to specifically do, this is when we're going to have it finished by, and then we can do that part. There's lots of other things that have to happen, and I think that's well understood, and this is not, I don't think anyone should see this as being the only thing that needs to happen. It's certainly not. This is a very small part, frankly, of what needs to happen. But I also think that time is of the essence. We are, I think, very fortunate so far in London that we have not seen a lot of tainted drugs that contain fentanyl and kill people very unexpectedly and in very large numbers. It's starting to come. We just saw news reports about it happening in Toronto. We had earlier this summer, our police issuing a warning around watch what drugs you're using because we had so many overdose deaths or overdoses in one weekend. And so it's the kind of thing that can turn very quickly. If you start seeing fentanyl showing up in drugs that people are not expecting it to be there, people will just start dying in large numbers. 25 overdose deaths is obviously a lot, but it could be much, much higher than that. And it's not just the overdose deaths, it is also all the deaths that come from the infections from the injecting practices. And those are longer term deaths, there's slower deaths, they don't happen just like that, but they're deaths nonetheless. And we have people dying in their 30s and their 20s from infections of their heart because they're injecting these drugs and they carry so much bacteria throughout the system, and then they get the infections and they die way, way too young. Those don't show up as overdose deaths, but they're drug related deaths, and they're also preventable. So the idea of waiting and getting a report back, especially a report back from our civic administration, they're great people. They're not really the leaders on this particular file. It's really the health unit and a number of people. And what's happening here is the mayor has said, I'd like to get a mandate from council to bring together some people so we can figure out what the mandate of this group will be and what we're going to do specifically. I think that's the appropriate way for him to do that. I hope people will support that. I don't think it needs to be a group that meets for a long time. Hopefully it only meets for 4 or 5 months and it figures out its pieces and they're done. And we can go back to having one less group that's doing things. So I think this is a good idea. I hope my colleagues will support it. If they don't support it here at committee, I can talk about it again at council.
So before we go to round 2.5, I just wanted to ask a few questions. So if you're okay with taking the chair? Great, thank you.
You have my name down?
Yes, I do. You're next after me. So I just had a few questions. So I'm just trying to understand this as well. So maybe I'll start with you since you're our visiting guest. So you talked about there is already an existing group that is doing some of this work. The intent of the mayor is to expand their mandate. So the existing group, would it not be just opportune to just expand that existing group's mandate, or you're just hoping to have them separate altogether and to be the overseeing body? So that's my first question to you, through the chair.
Through you, Mr. Chair. So the group that I was referring to is a supervised injection site local leadership group. And that group just started in April, and that was as a result of the presentation and the that we took to our board, and our Board of Health made the recommendation that we explore next steps for SIS. So as a part of that initiative, we created the initiated local leadership group. So that group met only once when I was the acting medical officer of health, and had another meeting when I wasn't. So that during the second meeting that they had discussions about what is the focus of this group, and they felt that SIS is part of the solution and part of the potential action, and that's why they are the mayor is asking to expand the group's mandate. So that's the SIS local leadership group that I was referring to.
And just through the chair again, so I understand that you said the mayor is asking to expand their mandate. So you just want to make that group bigger or create two groups is what I'm asking.
Through you, Mr. Chair, I think they want to keep the group, but they want to expand the mandate so that SIS is part of the mandate of the group, but then they will, work on opioid response strategy as well.
Okay, all right, so I'm still confused on that piece, but I'll leave that for now. To civic administration, if the current motion on the floor, what would be the turnaround? Could you get this back to the next cycle to us? Through the chair.
Through the chair, yes, we can endeavor to get information back to you. I want to be clear, though, that the lead for this working group would not, further to a comment I think was made by a councillor would not sit with the city. We'd be providing information back to you on work that's happening in our community. Is that correct? I want to be clear.
Sorry, are you referring to Councillor Helmer's remarks, or?
I am through the chair, yes.
Sorry, so Councillor Helmer, I'm not sure if you wanted to clarify that, or?
I think she accurately characterized what I said.
And so we'll endeavor to get information back to you with respect to this, resolution that's on the floor at this point.
Thank you, and to the chair. So my other question was, when we talk about the, you know, the city, what I heard from you a few times was that the city would kind of be the group, or civic administration would be the ones to figure out which groups would be the ones to be brought in and stuff like that. To me, I find that that expertise would kind of lie with the health unit and telling us who we need to kind of bring in. So was that the preference, that the civic administration kind of say, these are the groups we were hoping to?
Through you, Mr. Chair. No, I'm sorry, I didn't mean to indicate that. If I did, I apologize for that. But I don't think that it's up to the city administration to do that. I think it's up to this existing group that has a police chief. It has Dr. Mackey, the mayor is part of the group, and Brian Lester. So that group, I think they can identify who needs to, if they would like to expand the group, then they would be able to expand, to suggest who needs to be part of the group.
Okay, and through the chair, sorry I'm going back and forth, but this is just helpful. So I just heard you say, so the mayor is already part of this group.
Yeah.
And, okay, so there's a group that already exists that he just happens to be a part of, and so you're not asking for a new group to be created? He just wants to expand that, because how I read his letter is to liaise with community stakeholders in order to establish an opioid crisis working group. So from what it sounds like, he's trying to create something separate from that, from how I'm reading this, because it doesn't say to expand the mandate of an external group that already exists. So I'm not sure if anyone here is able to, I don't know, maybe Councillor Van Hosen, since you're the acting mayor, I'm not sure if that was his intent. I'm just trying to really understand the intent.
Okay, thank you. Yes, I believe that group was already established. I apologize. I'm in a similar position. I'm the acting mayor, but I don't have the information that the mayor has. But that was my understanding, that this group existed. It had been on my radar, and I was actually going to ask to be a part of it. So this may be one that I do ask to participate in as well. So I think, again, that it looks to me like the mayor's looking for some resources from the city to expand what they're already doing. Just take this group and give it a larger focus, rather than just looking at safe injection sites, look at the opioid crisis in a broader sense, and then come up with terms of reference so that we can take some action. The terms of reference will talk about how they consult with the community and explore the situation, and how they'll come up with some recommendations which are sorely needed.
Thank you so much, and sorry for the unusual thing. And through the chair, so I guess my quick comment is, I'm supportive in trying to address all our issues in our community. I think what's in, and I appreciate the intent of the mayor, but I'm still trying to learn and understand everything, and then it's all starting to come to me now. So it's very hard to kind of say, as in my capacity to endorse and say, here's a check for resources, because I kind of heard the acting mayor indicate that there would be some resources. I'm not sure how much those resources look like and what's the implications of that, so I can articulate that to community. I know some of my colleagues have indicated that they have concerns with, the immediacy of it. I think since this group is already in existence and is already doing the work, from what it sounds like, I think that the parallel really is to kind of have a report back to kind of explain how we can have a role, because today I don't know how the city would have a role. And I think that's kind of, from how I'm reading it, pretty much part B realistically, staff are gonna kind of come back with the motion that is in front by Councillor Squire. The only part really is just the A, but the A, from what I heard, is, which is to establish an opioid crisis working group, but it already sounds like there is an established working group. So it kind of sounds like, it we'll get to the same place unless someone can tell me otherwise. But I'll go to back to the speakers list. So Councillor Usher, I'll take the chair back and it's your turn, and then Councillor Cassidy.
Well, thank you, Mr. Chair. I want to make this easier because I think we spent a lot of time with this before already. And I do appreciate hearing from my colleagues, and I really do think that maybe we need to move on this. I was going to agree with this motion that said, but I'm not going to agree with it if I could get one little thing put in here. I do agree with you that there may be a group established already, but it's not, we never approve it. And perhaps that's the reason why the word is established rather than expand. I'm going on that assumption. With the B part, when this is established, I'd like to see its relationship with other groups. And that's all I care about as far as going forward. So the group is going to be there, but I'd really like to see its relationship with whatever else is out there so that I understand the total picture. So I can't go, I'm not going to go along with the motion that is on the screen right now. But if that loses, then I'm going to go along with the motion that is here on condition that I could add a few words in B. And at that time, then I'm going to ask for opportunity to add those words. I just don't want to spend a lot of time because it doesn't seem to me as though we have full support for this motion right now.
Councillor Cassidy, Armstrong, Squire.
Okay, thank you. I just wanted to, for you, Mr. Chair, I just wanted to try to explain that the current group, the SIS or Supervised Injection Site Group. So that's the only thing that group is looking at, supervised injection sites. So in looking at that and in seeing that one aspect, it is one aspect of the opioid crisis. So the opioid crisis would be up here, and supervised injection sites is one possible mitigation measure to deal with some of the problems that are resulting from the opioid crisis. So if we only left that mandate as the supervised injection sites, then that's all they're looking at. Whereas the opioid crisis working group would look at that in addition to all other possible solutions or mitigation measures and the whole entire crisis itself. So, and I think Dr. Hovhannissian was really effective in her presentation and in pointing out to us the unique and urgent situation that this is. And because it's a drug situation, I think, and we have all these other working groups and strategies going on right now dealing with other little parcels of the drug situation in London, it's difficult and it's complex for some people to wrap their heads around. But if this was something like SARS, or if this was something like Ebola, and Dr. Hovhannissian came to us and said, we have a SARS crisis in London and we need to work fast and everybody come together with leadership from the city to address this crisis and do it now before more people die. We wouldn't hesitate. We would not be referring that back to staff. We would move on that immediately. And I think this situation is just as urgent, but it's just because it's drug addiction and it's drug use that it doesn't seem, we don't put it in the same perspective as we do with something like SARS or something strictly medical. People are dying in London because of this situation. And I think we need to move forward with this. I think we need to defeat the referral that's on the floor. I invite Councillor Usher, through you, Mr. Chair, to move the motion and add the wording that he wants to add. And I'm ready to vote on that motion that Councillor Usher would move. I would be very happy to second it.
Councillor Armstrong?
I too agree with the councillor's comments. The word crisis was used. So it is a crisis or it isn't. If it is a crisis, then act like it's a crisis. So I think I'm not going to support this either. I would prefer to see it treated like a crisis, not like a referral. Referrals could take time. I think action is appropriate. I'm kind of puzzled, like the province, correct me if I'm wrong, because I'll ask you to respond to my comments afterwards, but the province has said this is a crisis. So when there's a medical crisis, province-wide, each health unit in each area is to implement crisis plans, whatever it is, if it's SARS or whatever. So the provinces said this is a crisis, so shouldn't this be led by the, health unit? Shouldn't it be treated like a crisis, and shouldn't you go into crisis mode and take, here you are at our council looking for us to, and the mayor put together a committee. Do you not have the authority or mandate to deal with a crisis on your own? And now, if you don't have financial resources to deal with the crisis because the province doesn't provide it or doesn't have to, if you came here looking for money, I'd certainly be willing to entertain that. But why aren't you in crisis mode? Why aren't you acting on your own if you're the health unit and you're charged with dealing with crisis? So if through you, Mr. Chair, if I can get an understanding on that issue a little more, I would appreciate it.
Through you, Mr. Chair. So I think that's a very valid point. We do have a mandate, and we do have a mandate to work with key stakeholders because we can't do alone. We can't accomplish much. So we do need to work with stakeholders. We do have a mandate to work with them to develop the surveillance local opioid early warning surveillance system, as well as to increase access to naloxone program, as well as to work on opioid response plan. And again, so I apologize if I'm not effective in answering questions because, as I said, I'm covering for Dr. Mackey. Unfortunately, he's on medical leave. I don't have a lot of understanding from the meeting that happened and what the mayor and the key stakeholders that were at the table, because Dr. Mackey, as a medical officer of the health unit, was at the table. So they feel that this is a citywide crisis and it would benefit from a city's participation in making sure that the response is integrated and the response is comprehensive. So we are not shying away from our responsibility, and we are going to be at the table, and we are going to be doing much of this work, and we have the staff and skill set and resources to deal with that.
I think the councillor's question to maybe help, I think he was asking, do you not have the authority to strike this working group on your own, if I'm not mistaken?
Well, of course we do. We can do it on our own, but in other places, in Toronto, for example, the city council is leading the opioid crisis working group. So same as for Ottawa. So there are cities that are taking ownership and they're working closely with their health departments. It's not that that they are doing it in isolation or health department is working alone. So it's a joint effort. So it's a citywide crisis and all parties need to come together to resolve the crisis.
Councillor Armstrong?
Well, I guess the thing is, and I certainly think the city should be at the table and participate and support, but I think it's an initiative that should be undertaken by the health unit, and then they go out and bring in who they feel they need to deal with the crisis. Less so the city. I mean, there's very few of us that have any knowledge of this issue. And have the expertise and, and our staff, I don't know how much expertise they have in this area, but I think being invited to participate is important. I think this city should be at the table, but I think the health unit should be inviting those to, I think this should be a health unit only initiative and you should ask who you want in. That's sort of my feeling. I'm not prepared to delay anything. because I'd like to see things move ahead. But I did want to ask, if I went to your website, would I find information on your website warning me about the dangers of overprescribed opiates? Would there be information there about who to contact if you feel that you have an issue specifically to do with opiates? Is there an action plan already in place through your organization, a public action plan to educate the public, warn the public, also warn doctors that this is an issue now and that they should think twice and re-examine before they write that prescription whether there are alternatives because of the information available now that we'll say wasn't available before, but that's, I don't know whether it was or it wasn't, we'll see. But is that kind of thing already in place and happening?
Through you, Mr. Chair, one of the groups that I mentioned has representation. We have about 10 or 12 doctors working together and trying to, these are leaders in the field, so they are working together to develop a workshop for physicians. So there is a plan for bring physicians to inform them about local situation, as well as give them information and resources to effectively prescribe opioids or not prescribe opioids unnecessarily, as well as taper opioids. So with regards to just community awareness, we did work, and as a part of the outreach efforts that we do work with people that are impacted. So, and that group worked on resources for addiction resources for people that suffer from addiction. But we are just one of the players. So there is Addiction Services Thames Valley. So they have resources available on their websites too. There are other, community partners and stakeholders that they have information. Of course, as everything else with our medical care, we are very fragmented and information comes in different places and different pieces, which makes it very difficult for people to navigate. And in particularly with regards to addiction, one of the most, challenges that we have in the community, we don't have integrated addiction services. And as a part of the strategy dealing with HIV crisis, we have been advocating for integrated community-based addiction services, which would hopefully also incorporate detox for those that are using crystal meth and using stimulants. Again, so there is so much work that needs to be done. And that's why we need all the parties to be involved. And it's great that we are having this conversation together. So I hope that, this information is informative for city councilors.
I guess the thing is, if I went to my doctor today, would I find that he's been contacted in the last 6 months by the health unit about the issue of opiates? That there'd be information I could find on the wall about warning for the community to take off his wall. There's lots of information I know there about prevention of diabetes and all. Would I find information on the wall in my doctor's office or any doctor's office in the city from the health unit with information about opiates, the issue of opiate prescriptions, alternatives, if you feel that there's an issue, talk to the doctor that prescribed it to you, get some help, that sort. Would I find out there information right now that your organization has provided? Because from my earlier question, it sounded like we're working on approaching doctors and having a forum and, and that sort of thing. And I kind of would think that something should have already been out there, that they should be aware, not through the media, which the media does give out information. And I heard about this crisis through the media and other sources. But have you done your job by letting the doctors know information and contact already?
Through you, Mr. Chair, we do issue healthcare provider newsletters, and we have about 1,000 doctors that are prescribed. So we do send them information about opioids, and we do send them information about the new guidelines. The problem is there is information overload. So the chances that the doctors are just going to be waiting for the information to come from the health unit and they will be opening that information is not that great. That's why we are working on bringing them together as a group, so to have a workshop for them, so they would be able to learn about some of these problems that exist in the community, because there is no shortage of information out there. So it's like the doctors are overloaded with the information. How much they're using of this information, it's hard to tell.
Thank you. So before Councillor Squire wraps up, any other speakers on the motion that's in front of us? On the motion that's in front of us, go ahead, Councillor Van Bos.
Okay, yes, thank you very much. I know that we've got an expert in town in Dr. Sharon Koivu, who's lecturing around the province about this. So this is something that's fairly new for doctors. They're coming to this knowledge, and we can be leaders in that. I know that Dr. Mackey is very interested in this, and the mayor. I realize that the issue is, or the motion was perhaps a little vague for the committee, but I think we can trust them until the council meeting, and we'll have enough information to make this decision. I want to thank the doctor for coming here. I won't support the referral. I'll just support the motion as it comes forward. Thank you.
Councillor Usher, can you take the chair for a sec? Just because this will be my last opportunity to speak, if that's okay.
Go ahead, Councillor.
Thank you, and through you. So, I appreciate, the merit of this and the intent of just trying to help our community. And I know you mentioned we have many crises in our community. I know this is the one that's being talked about today. But, in my experiences from outside of here, I know that this is one issue today, tomorrow, and I know there was, a comment made about, SARS, but I know there's also other issues like the hepatitis C and HIV. I don't have the stats in front of me, but I'm assuming that those numbers of deaths every year are pretty significant as well. So my intent in supporting this referral is not to say that this isn't a crisis and we shouldn't act. Because I would say, we need to have an HIV crisis working group. We need to have a hepatitis C crisis working group. The list can continue to go on. But what I need to be able to tell people in the community is that why I'm supporting this and the resources attached to this, and just trying to have a better understanding, because the Middlesex Health Unit doesn't just represent London, but it represents our neighboring communities. But now what it seems like now is we're going to have a London working group, because if it's being funded by London and it's a London working group, it seems like is the extent, unless this conversation is being had in other councils. I'm not sure if that's the case, or the other mayors of other cities that going in front of their councils. I guess that's my question to the chair.
Can anyone else answer that question? Well, no.
Yeah, no problem. So I think that would be, I guess that's my feedback. Oh, she couldn't tell me.
Sorry, I guess I couldn't turn this on. So you were asking whether the other councils, you mean Middlesex County was involved? So, when we are looking on at the data, and by the way, we do have HIV leadership group as well. So we are not asking city participation on that, because the health unit is leading that work. So we are working on that one with key stakeholders involved. So with regards to the question about why London, if you notice the data that I presented, majority of the problem, including prescription drugs, not only prescription drugs, but deaths, emergency department visits, there is a disproportionate London focus there. So the county is impacted, but less so than the London. So that would be kind of my response. Sorry, was there a second part to that?
I guess the follow-up to that, I guess, would be, you mentioned, you have an HIV crisis working group, but you don't want to ask the city to be involved with that. Can you explain why we want our involvement with this particular one versus with the HIV?
So the HIV group is more straightforward because we have representation from the hospital, infectious disease doctors, and we have representation for other providers that treat HIV. We have representation from organization that provides support to people with HIV, like Regional HIV AIDS Connection. We have Aboriginal community representation. So that's a smaller group. So, and that group has been working together for over a year, and we were very successful in securing funding from federal government. We received a grant of $1.2 million, and we have been advocating for support from provincial government. So we are working with provincial experts and groups like AIDS Bureau and HIV and AIDS Treatment Network. So there are stakeholders that are involved. So that group is kind of more sufficient. The opioid one, the reason that, that one is a different problem and requires different level of involvement is because it's not just the healthcare partners that we need for that one. So for that one, you need your EMS, you need your fire, you need your, the hospitals, and you just need to be able to respond when a crisis, overdose crisis hits the community. Being, like as a city, showing leadership and taking this one on will allow for having those multiple representations, similar to what we do during citywide emergency exercises when a problem of concern comes and brings together of all the parties that are need to be together to respond to a crisis like that. So for HIV, we don't ask for that. We don't need that.
Thank you very much. So my last comment then would be, I don't think this is really a stall. Like staff said that they can come back relatively soon. And I think even within that same context, they're able to answer some of these questions that would ultimately kind of happen, and these conversations would continue to happen. So for me, I think this is kind of just having a better understanding on what I'm voting for, the impacts. I know I've heard, 2 or 3 times it being said, comments about resources, but, and the mayor just talks in his letter just about liaising. So I'm not sure what the impacts are with that, and I'm not sure what that's authorizing us by if this isn't supported what the next motion is. So that's kind of why, just getting that information isn't really the stall. It's you're asking us to do something that a lot of us aren't trying to understand. And here I am at committee trying to understand the intent, and, maybe at council, when the mayor is there, be able to have a better understanding. So that's where I'm at today. So thank you.
No, you're going to speak? You want to speak?
I was going to sum up, but, that might be another hour, but we'll see.
I'll pass it on to you.
Thank you. No, I passed the chair. That's why I had to wait for Councilor Usher. Now it's your turn to sum up. Go ahead.
I just want to clarify what I'm not doing, because one of the things is, and I hear this all the time when I bring a motion at council, by the time it gets to the end, people have said things that I want to just clear up that I'm not doing. I understand that people die from drug abuse. My clients die of drug abuse. I'll just wait till everybody's listening. I'm representing someone this week who drinks hand sanitizer out of the women's washroom in the ward she's in, and we have to watch her all the time because she could kill herself doing that. So I don't appreciate it when people sort of suggest that this is a delay and I don't appreciate the consequences, and people are actually dying and I don't realize that. Believe me, I do, because I deal with it every day. So I just want to clarify that, because it's important to me that people understand that. And I know people get emotional and they start saying, comparing this to other things, but I just want you to know how seriously I view this. I also want to thank you, Doctor. It was extremely helpful. and, with what you brought today here, and I appreciate it very much. But I'm like Councillor Salia, I'm still left with a lack of clarity is exactly what we're doing. I've heard at different times, and certainly the language here says a new committee. It says here, in order to establish an opioid crisis working group. So my understanding coming today was it was a new group. And then I heard at different times, no, this is an extension of a group that already exists, or it's an umbrella organization. And I can't right now sit here and understand, and I don't understand what it is that we're being asked to agree to in terms of what that committee is and what it's going to do. Similarly, the membership, I see letters from people saying, thank you for inviting me to be a member of this working group. I mean, I don't know if membership is open. I don't know if I can join. I don't know if I'm welcome to join. I absolutely don't. I actually have some expertise in this area that I could bring to the table, but I don't know if that's something that's going to happen. I don't know if my colleagues who've asked to be involved in this issue are going to be given that opportunity. I would like to know that. I would also like to know what these terms of reference are. They're going to be broad, but it's unclear to me. So I'm hopeful that the referral would help with that, and that's why I'm going to vote for it. It's not so people will die while we're waiting. Believe me, it's not. I've seen enough of my clients die. The other issue is that I need to know that this is going to be effective. And I've heard so many different versions of what this committee is and what this working group is that I really need clarity. And you helped a lot today, Doctor, in doing that. And Councillor Helmer helped a lot with that, quite frankly. So I'm going to vote for the referral, not because I don't want to deal with a crisis. I understand that, but because I want to make sure we do it right. And I hope people understand that and give me some credit for that.
Thank you very much. So I'm not sure if you had your hand up, Councillor Holst. Okay, thank you. So we'll call the question.
Closing the vote, and the motion fails 4 to 2 with Acting Mayor Van Holst voting nay.
Councillor Usher.
So, Mr. Chair, I'd like to put the motion on the floor with a little caveat that the clerk knows where to add it.
And I see you have a seconder already. Councillor Cassidy as your seconder. Go ahead. So they'll get it up on the screen, so if you want to speak to it, go ahead. I said, did you want to speak to it, or are you?
No, I think I spoke to it enough already. The whole idea of this is just to show the bigger picture. I'm quite prepared to go along with that.
Any other speakers?
Is it? It looks different.
I'll just give everybody a minute to read it just to make sure they know what they're voting for. Councillor Usher?
Just to help those who are reading it, this is the same motion that is on page 72, except that in B, we added right in the middle with details of its relationship with other strategies and working groups, and the rest remain the same.
Great, I'll just give everyone a minute. I just see some people reading, and then if there's any other speakers, I'll look to them. So if you could just, I want to separate part A and then the rest for me, because I just vote on that, and then we can vote. So you can move part A. Any speakers? And we're voting.
I'll vote yea.
Closing the vote, and the motion carries 5 to 1 with Acting Mayor Van Holst voting yea.
we'll put the remainder on the floor. All right, any speakers? And we're voting.
I'll vote yay.
Closing the vote and the motion carries 5-1.
All right, on to the next one. So, number 5, so did you want to speak to it or move it?
No, just move.
So it's, item number 5 is moved. Look for a seconder. To approve the delegation request?
Yeah.
Okay, and second by Cassidy, Councillor Cassidy, sorry. And it's on the screen. Any speakers? And we're voting. And Councillor, Acting Mayor Van Holst is voting yea.
Closing the vote, the motion carries 6-0.
Items for direction, public submission from the London Library, Museum London. Councillor Usher.
I'd just like some explanation with respect to the last line in this letter. We respectfully request that the matter of the art collection be referred to the Community and Protective Service Committee to City of London Administration. I'm not so sure. Are we referring this whole thing and let the city do it? Is this what?
Yeah, so we'll get Ms. Armstead up and she'll be able to speak to this. And if anyone wants to move it on the screen in the meanwhile, they can.
Through you, Mr. Chair, what we're asking for today is that the whole issue be referred back to staff, particularly legal services and finance would like to have a look at this to bring this back to you with more information.
Councillor Usher? Yep. Perfect. So it's been moved and seconded. Any further speakers? And we'll call the question and we're voting. Councillor Acting Mayor Van Holst is a yea. And Councillor Squire, you can vote on the screen.
Closing the vote, the motion carries 6-0.
So in item number 7, we'll get that up. I believe there was a request for the wording. We'll get that up for you for your benefit. And we'll just look for someone to move and second that. Moved by Councillor Usher. Seconded by Councillor Cassidy. It's up on, sorry, you have a question or?
Yeah, so that's my question about the community awareness event. So they're asking us, this is their subcommittee, but they're asking this committee to approve in principle? I just want clarification on that.
I don't know if Ms. Graham is aware. I'm not seeing anyone from DIAC here. I'm assuming that's the case.
Yeah, they just
They wanted approval to go ahead and do that, from what I'm hearing from, and they're going to report back to this committee.
to the DX.
Sorry, to DIAC, and DIAC, I'm assuming, will report to us. Floors, you good? All right, any further speakers? And we're voting.
So,
Oh,
is it gone?
Councillor Usher, sorry. No, it's up on the screen, we're voting. Did you want me to stop the voting? Yes or no? No, Councillor Usher, are you okay?
The 5. What are we doing with 5? They eliminated 5.
Sorry.
Can you tell me what happened to 5? Is it?
It's AI, a community awareness event based on, it's there.
Okay.
And Councillor Van Holst, yay or nay? Yay.
Closing the vote, the motion carries 6-0.
Okay, deferred matters list. Look for someone to move that. Moved by Councillor Van Holst. I guess you can't do that on the screen, so it might be a little slower. So we'll get someone else to do that. But we enjoy your enthusiasm. So get someone to move. Any speakers? And we're voting. You guys are too slow, so I had to push it to get us out of here. Councilor Verhulst is a yay. Item number 9. Sorry, Councilor Usher, can you vote?
Closing the vote, the motion carries 6-0.
And 9, we just move for seat. So get someone to move it on the screen. Moved by Councilor Cassidy, seconded by Councilor Armstrong. Once it's up. Councilor Van Holst is a yay, strong yay. And we're voting, yep. Van Holst is a yay.
Closing the vote, the motion carries 6-0.
Look for a motion to adjourn, unless there was any additional, sorry? Oh, yeah, Armstrong, moved by Armstrong, second by Van Holst. All those in favor? Opposed, if any? And it carries. I will see you guys, hopefully, maybe not on the 28th.